Well, seeing a physician during the pandemic is already challenging, but local patients are saying sometimes their longtime doctors are just retiring.
It's left them scrambling for medical records and prescription refills. KXAN investigator Kevin Clark explains what Texas doctors are required to do for patients when they leave their practice.
He was a very good doctor.
When Bill Eastman needed a prescription refill this summer, he called the Austin office of the doctor he'd been seeing for more than a decade.
I called and tried to make an appointment, and the phone was disconnected.
Other patients showed up for appointments in the weeks to follow and saw this, a sign saying Dr. William Moran had retired and the office was closed. And patients tell us the phone number listed didn't work either.
Retiring without giving us any notice is very much unlike him. I don't know what happened.
Frustrated reviewers on social media detailed their struggle to get their medical records from the practice. One said Dr. Moran abandoned his patients overnight.
We had no information at all.
For Steve Olson, a similar story.
I was worried a little bit about him, whether he had had some, health issue or something.
With patients hearing nothing, I tried to reach Dr. Moran too, including going to his old office in this building on 35th Street. An employee of a neighboring office told me they were told about his retirement, but the move out was abrupt, happening in the span of a week. So I tried to reach out via email. I never got a response, so I called a cell number listed for the doctor.
Hello?
Hi there, I'm looking for Dr. William Moran, please. The man who answered wouldn't identify himself as the doctor. When I told him who I was, he said,
No, I'm not interested in talking to you about that. Thank you.
Dr. Moran has been in practice for 31 years, and his license is still listed as active according to the Texas Medical Board. The board has requirements for doctors who are retiring or relocating. This includes posting signage in their office to give patients at least 30 days notice. Also, telling them where to get medical records. Patients seen in the last 2 years should get a letter or email. And finally, doctors must notify the Texas Medical Board within 30 days of retirement. The board says Dr. Moran did notify them, but his patients tell us they're the ones left in the dark.
He does deserve to retire, just not the way he did it.
Eastman says he filed a complaint with the board, and it's important this doesn't happen again.
If he tries to get in practice again, hopefully he won't be able to.
Kevin Clark, KXAN Investigates.
Since last week, we've been asking the Texas Medical Board how many doctors in Texas have retired during the pandemic. A board spokesperson told us to make a public information request. He added it would be hard to determine which doctors were required to because of COVID-19.